Good day, nurses. So for today, we will discuss your osteoarthritis and rheumatoid arthritis. Okay? Both conditions, guys, are chronic joint disorders, meaning, guys, greater than 6 months. Okay? But they have different causes and pathophysiologies. Okay? So your OA, guys, or the osteoarthritis, it is a degenerative joint disease. Okay? While your RA, guys, it is a autoimmune inflammatory disease. Okay? When we say degenerative, guys, for example, habang ginagamit yung katawan natin, guys, nagde-degenerate yan. Okay? While your autoimmune, guys, meaning your body attacks itself. Okay? That's the autoimmune. So, but despite these differences, guys, the goal of nursing care are similar. Okay? Such as pain management, joint protection, and promoting mobility and independence. Okay, so to understand arthritis, guys, we must first understand the structure of a normal synovial joints. Okay, so in your synovial joints, guys, makikita mo dyan yung bones, okay? Your bones, okay? And the bones, guys, are meeting or connecting each other, guys. Yun yung tinatawag natin na joint, okay? And your bones, guys, their ends are covered by articular cartilage. Okay? The end of the bones, guys, are covered by the articular cartilage, which acts, guys, like a shock absorber. Okay? It prevents the bones from rubbing directly against each other. Okay? That's the articular cartilage. It reduces friction, it absorbs shock, and it allows smooth movement. Okay? Sa madaling salita, guys, your articular cartilage protects the bone surfaces. Okay? What else? The synovial membrane. So, it is found naman, guys, in the inner lining of the articular capsule. This is your articular capsule. Then, dito mo makikita si synovial membrane. And, si synovial membrane, guys, siya ang nagpro-produce ng synovial fluid. Okay? Itong synovial fluid naman, guys, nag-a-act as lubricant and also for nutrient absorption doon sa cartilage, 'di ba? Kasi ang cartilage, guys, wala namang blood vessels diyan. So it depends kay synovial fluid for nutrients. Okay? And may makikita rin tayong joint space diyan, guys. Okay? It is the gap between the bones. Okay? So kapag healthy ang joint, guys, dapat ang space is wide yan, okay? And nagmo-move smoothly ang mga bones, okay? And walang friction na nangyayari or walang bone-to-bone contact na nangyayari, okay? So let's discuss now the osteoarthritis. Okay, your osteoarthritis, guys, sabi natin kanina, it is a degenerative joint disease characterized by progressive breakdown of the cartilage, okay? It is mainly caused by wear and tear of joints over time. Yung sinabi ko kanina, guys, na habang ginagamit yung katawan natin, guys, nasisira, is specifically si cartilage, okay? Anong nangyayari kay osteoarthritis? There is cartilage degeneration, okay? Due to aging, ganyan, or repetitive stress or joint injury, okay? The cartilage begins to wear down and nagiging thin siya, okay? Because the cartilage act as a shock absorber, guys, its loss removes protection between the bones, okay? So when the cartilage becomes damaged, guys, the cushioning effect, guys, is nagdi-decrease, okay? Then the bones, guys, start rubbing against each other, and this leads, guys, to pain and inflammation, okay? What else ang nangyayari kay osteoarthritis? There is osteophyte formation because the body, guys, attempts to repair the damage, okay? As a result, new bone growth forms at the edges of the joint called osteophytes or bone spurs, okay? Ito yung mga yun, guys. Okay? However, this spurs, guys, causes joint deformity and nililimit niya yung movement because of the pain na nafe-feel no patient. Okay, what else? Ano pang nangyayari? There is joint space narrowing, as you can see in the visualization, because the cartilage is lost, guys. The space between the bones decreases. Okay? This is called the joint space narrowing, which is clearly seen in X-ray. Then, since there is joint space narrowing, guys, nagkakaroon ngayon ng bone-to-bone contact. okay? Causing now guys to have a severe pain, limited mobility, and joint stiffness, okay? Now, what are the risk factors kung bakit nagkakaroon naman ng osteoarthritis? Okay, first is the aging. Yan yung sinasabi natin na wear and tear guys, na habang ginagamit natin ang ginagamit as we age guys, yung katawan natin nagde-degenerate yan, okay? Your cartilage guys naturally or normally degenerates with age, okay? Then secondly is the obesity, okay? Because of the excess body weight increase, okay? So kapag mabigat yung binubuhat ng ating joints guys, then therefore nag-i-increase ang joint stress. O what else? Lastly, through joint injury, okay? From repetitive stress from occupations like farming and construction, okay? And joint injuries naman guys from sports, okay? This increases guys the risk of OA. Now, the typical clinical manifestation guys of your OA guys, it includes joint pain and stiffness, and it is commonly affecting guys the large joint ang nina-affect niya, okay? Specifically your hips, knees, and hands, okay? And the key feature of your OA guys, the pain is worse with activity, okay? But nag-i-improve siya with rest guys, okay? Bakit siya worse with activity? Diba nga, ang cause is degenerative. So habang ginagamit mo then therefore nag-i-increase din ang pain, of course, diba? Patients may feel or hear grating or crackling sound during movement. That's your crepitus na tinatawag. That's the grating or crackling sound during movement because nagrarab yung bones niya guys, diba? Kasi nasira or na-damage ang cartilage. Okay, so now let's discuss naman the hair burden and Bouchard's nodes, okay? These are bony enlargement of finger joints, okay? When we say hair burden nodes, guys, it occurs at DIP joints or the distal interphalangeal joints. And when we say Bouchard naman, guys, it occurs proximal interphalangeal joints, okay? They occur, guys, because of the bone overgrowth due to cartilage damage. Okay, for you to easily memorize it guys, when we say hair burdens guys, nagsisimula siya sa H, tama ba? Yes, so high. Matatagpuan mo siya higher than the Bouchard. Okay, when we say Bouchard naman guys, di ba? It starts with letter B, so below. Okay? And when we say proximal guys, meaning malapit sa katawan natin, tama? And when we say distal guys, meaning away from our body. Okay? Now, let's discuss the nursing interventions, okay? The goal for your OA guys is to reduce the pain and preserve joint function, okay? First, anong gagawin mo? Weight reduction, okay? You encourage weight loss to reduce the pressure on joints, okay? What else? Joint protection, okay? You teach the patient guys to avoid excessive joint stress, or pwede mo rin siyang i-instruct guys to use assistive devices when needed. Okay? So that makatulong na magbuhat dun sa weight niya. Okay? Hindi mabigatan yung joints niya, causing now a pain. Okay? Then, what else? Pain management. Okay? This includes guys administering analgesics, NSAIDs, and physical therapy. Okay? And if pain becomes severe guys, the patient may undergo arthroplasty. Oh, that's the joint replacement surgery. Okay? Now, let's move on to your rheumatoid arthritis. Unlike doon sa OA guys na diniscuss natin kanina, which is caused by wear and tear or habang ginagamit, nagde-degenerate siya, your rheumatoid arthritis guys is a autoimmune disorder. This means guys that the body's immune system mistakenly attacks its own tissues, particularly the synovial membrane of the joints. Okay, anong nangyayari? Anong ina-attack niya daw? It is a autoimmune disorder that attacks the synovial membrane of the joints. Okay? Ito yung nasisira guys or nai-inflame. Ito yung ina-attack ng ating immune system. Ano yung function niya na sinabi natin kanina? It produces your synovial fluid. That's why guys, doon sa synovial fluids, nagiging cloudy siya and also increase ang WBC. And since inflamed yung synovial fluid guys, there is a excess, okay, production of the synovial fluid. Okay? So as a result guys, rheumatoid arthritis causes chronic systemic inflammation, meaning kumakalat siya sa ibang parts ng ating katawan. Okay, so what are the clinical manifestation of your rheumatoid arthritis? Okay, the most common symptoms includes joint pain and swelling. Okay, your rheumatoid arthritis guys primarily affecting the small joints. Okay, small joints, while kay OA guys ang naaapektuhan niya is the large joints. Okay, don't be confused with that. Okay, such as your hands and wrists. Okay, and in rheumatoid arthritis guys, the pattern is different from osteoarthritis. Okay, the pain is typically worse after prolonged rest. Okay, and it is improved with activity. Okay, bakit guys? Because this happens because inflammation becomes more pronounced during inactivity. Kasi kapag immobile tayo guys, di ba the blood flow guys is hindi maganda. Okay? What else? Because rheumatoid arthritis is a systemic inflammatory disease guys, it affects the entire body. So the patient guys may experience fatigue, anorexia, and weight loss. Okay? These symptoms guys occur due to chronic inflammation throughout the body. And long-term inflammation can damage joint structures and lead to permanent deformities. Okay? One common deformity guys is your swan neck. Okay, so let's discuss the swan neck, kung ano ba yung nangyayari. Okay, in this deformity guys, the PIP joint or the proximal interpharyngeal joint guys becomes hyperextended. Okay, the proximal interpharyngeal guys dito guys nag-hyperextend siya, while your distal interpharyngeal joint guys ay nag-reflex. Okay, this one guys. Okay, this abnormal positioning guys occurs due to ligament damage and joint instability caused by chronic inflammation. Okay, and as the disease progresses guys, deformities can significantly impair hand function and mobility. So imagine guys, di ba? Now, let's discuss naman the diagnostic studies of your rheumatoid arthritis. Paano ba natin mako-confirm guys na may rheumatoid arthritis ngayong patient natin? Okay, by means of your arthroscopy with synovial fluid aspiration. Okay, dito kay arthroscopy guys, we are inserting a needle papunta dun sa joint guys, then we are aspirating the synovial fluid. Okay, so kapag cloudy and increase ang WBC dun sa nakuha nating synovial fluid guys, then therefore it indicates inflammation or infection. Okay, what else ang ginagawa? Yung synovial fluid guys na na-aspirate natin guys, pinapasa natin yan sa laboratories for analysis. Okay, so kapag yung patient natin guys or the synovial fluid of our patient guys is nag-positive siya for the rheumatoid factor guys, then pwede nating ma-diagnose na may rheumatoid arthritis nga si patient, or elevated or approximately 60 international unit per ml yung rheumatoid factor ni patient. What else guys? Kapag mataas ang ESR and CRP ng patient natin, your ESR guys is the erythrocyte sedimentation rate, and your CRP guys stands for your C-reactive protein, and these two guys are inflammatory markers, so indicating guys that there is inflammation or infection na nangyayari dun sa synovial fluid or dun sa joint natin. Okay, so doon natin matadiagnose guys na may rheumatoid arthritis yung patient natin. Okay, now since you diagnose na yung patient guys, meron nga siyang rheumatoid arthritis, what are the nursing intervention natin sa mga patient na may rheumatoid arthritis? Okay, since there is pain na nafe-feel ang patient natin guys na may rheumatoid arthritis, we manage the pain, okay, by administering DMARD such as your methotrexate, and biologics naman guys such as your etanercept, or the other name for this one guys is the adalimumab, okay, or infliximab. But this medication guys, your DMARDs and biologics guys, sinusuppress niya ang immune response natin, pinapababa niya ang immune system natin. Okay, so as nurses guys, we need to monitor and report signs of infection guys, such as kapag nagkaroon ng fever and sore throat si patient. So kapag nagkaroon ng sore throat and fever si patient guys, we need to report it to the healthcare provider because it indicates signs of infection. Okay, then the client guys must test negative for
TB before starting treatment with biologics. O bakit guys? Because TB guys, there is a presence of infection already, tama ba? Yes. And yung biologic guys is mas sinusuppress or pinapababa niya yung immune system natin, right? So, imagine guys, there is a presence of infection na then papapabain mo pa yung immune system ni patient, edi mas lalong naging immunocompromised na siya. Okay? What else guys? Fatigue management naman. Okay? So how do we manage that guys? We are encouraging the patient guys to rest during flares or acute episodes. Okay? What else? By splinting the joints guys to prevent contractures to happen. Okay? Then, instruct the patient guys to sleep with a small flat pillow under the head, okay? Do not place pillows under the knees, okay? To prevent nga the contractures to happen. Okay, what else? Client teaching and support naman guys. You need to provide pain management and joint protection teaching. So, ano yung mga pain management natin guys? Okay? So, we instruct the patient guys to rest and immobilize joints when in pain. Okay, what else? Apply cold compress for swelling and hot compress naman guys for pain and stiffness such as hot packs and paraffin dips. Okay, your paraffin dips guys, ito yung nagtutunaw sila ng wax guys, then ilalagay yung kamay dun, okay? Parang yung sa kandila guys, di ba pag yung wax ng kandila, di ba mainit yun guys, o parang ganun yung paraffin dips, okay? Then take analgesic or NSAIDs guys and corticosteroids as prescribed to decrease the inflammation. Okay? Then for your joint protection naman guys, we encourage low impact exercises such as walking, swimming, and Tai Chi. Okay? Then we encourage also the use of assistive devices guys for ADLs, the activities of daily living of the patient such as canes and self-fastening closures such as your Velcro. Si Velcro guys, yan yung ganun guys, yung detachable na ganun guys, nag-insert. For example, dun sa polo ni patient guys, instead of botones yung nandun guys, Velcro na lang guys. Parang yung ganun yun guys, yung itsura niya, yung detachable, yung hahatakin mo lang guys, yung na-attach lang siya, then hatakin mo lang siya guys, madedetach na siya. That's the Velcro na tinatawag. Kasi kapag debotones pa yung damit ni patient guys, then gagamitin niya pa yung hands niya guys. Di ba nga kay rheumatoid arthritis guys, ang naapektuhan guys are the small joints. Okay, what else? The use of electric can opener and a long handled hairbrush. Okay, what else? Avoid prolonged standing, heavy lifting, and repetitive motion such as knitting and typing. Okay, your knitting guys, yan yung pagtatahi. Okay, because it can trigger guys yung mga small joints, di ba? Pag nagta-type tayo guys and pag nagtatahi tayo, okay? Then use large joints guys rather than the small joints for tasks, okay? For example guys, press water from a sponge instead of wringing it. So, instead daw guys, napigain mo guys, i-press mo na lang daw para hindi ma-trigger yung small joints natin guys. Okay? What else? You provide emotional support for altered body image. 'Di ba? Kasi nga may deformity na nangyayari, specifically your boutonniere and this one neck. Okay, what else? And coping with chronic illness. Okay, then lastly guys, if chronic pain persists guys, prepare for possible synovectomy. That's the removal of the joint lining, okay? Or arthroplasty guys, that's the joint replacement surgery. Okay, now let's discuss the boutonniere deformity. Okay, sa boutonniere deformity guys, ang makikita mo guys, the proximal interpharyngeal joint ng patient natin guys are flex or bent downward siya, as you can see in the visualization guys. This is the proximal, this is the distal, tama? So si proximal daw guys, naka-bent downward siya. However guys, yung distal interpharyngeal joint ni patient guys is naka-hyperextend or naka-bent upward siya guys. Okay? To summarize guys, the deformity guys, this one neck and boutonniere guys, in terms of PIP guys, for swan neck, hyperextended siya or the proximal interpharyngeal joint ni patient kapag swan neck. When we say boutonniere naman guys, the PIP joint naka-flex yan, okay? And sa DIP joint naman, kapag swan neck guys, flex yan, okay? And kapag boutonniere guys, si DIP hyperextended siya, okay? Now, let's compare your osteoarthritis and rheumatoid arthritis, guys. Okay, in terms of cause, guys, your osteoarthritis, guys, is caused by the joint degeneration from the repetitive stress. Okay? What How about rheumatoid arthritis, guys? It is caused by autoimmune disease, okay? Attacking the joints plus causing systemic inflammation. Then in terms of pain pattern naman, guys, for your osteoarthritis, guys, nagwo-worsen siya with activity and it is better with rest, okay? However, guys, kay rheumatoid arthritis, guys, better with activity naman siya, guys, then worse with prolonged rest, okay? Then in terms of morning stiffness, guys, kay osteoarthritis, guys, naglalas lang siya less than 30 minutes. Then kay rheumatoid arthritis naman, guys, naglalas siya greater than 1 hour. Okay? So the joints affected naman, guys, in terms of your osteoarthritis, guys, is asymmetrical, meaning, guys, isang side lang ng katawan mo yung affected. Okay? Often the large weight-bearing joints such as your knees and hips, okay? While kay rheumatoid arthritis, guys, symmetrical siya, meaning, guys, for example, affected yung isang side, guys, nagiging affected din yung isang part ng katawan mo, and it affects, guys, the small joints, okay, such as your fingers and wrists, guys, okay? Then in terms of systemic findings, guys, kay osteoarthritis, wala, okay? Then kay rheumatoid arthritis, guys, it causes systemic inflammation, okay? So it causes fatigue, anorexia, weight loss, and increased inflammatory markers such as your ESR and CRP, your erythrocyte sedimentation rate, and your C-reactive protein. So increase yan kay RA, guys. And that is all for your rheumatoid arthritis and osteoarthritis. Thank you and God bless.